When you think about taking risk in anything, whether you do it as a person and the decisions that you make, or in this case, as we talk about healthcare organizations taking on risk, I think a simple strategy is to have as much data as you possibly can going into that situation so that you can make good decisions about the risk that you take. And in healthcare, we have value-based care arrangements, we have risk-bearing contracts all the time, and we know so little. Going back to the idea of we know the data, the healthcare data about a patient or a member. We know so little about their lives, and again, what is likely to help improve their care or lead to a deterioration in their care as part of that. So we are blind. I think about sort of a keyhole analogy, and we're looking at the world through that keyhole and have this tiny, myopic view of what's in front of us. And there's an entire world out there. I'd like to know what else is out there waiting for that patient, and again, in a position to either hurt or help them as part of that. So when you start to think about how am I going to manage and mitigate the risks at an individual level, and ideally achieve much better health outcomes for that person, that patient, that member, but also better financial outcomes for the organizations that are going to those contracts, they're well prepared for that.